This is Gary Atansi with CNTV, and today we're in Greenwood Village, Colorado. I'm here at Front Range Medical Center. Since 2002, this multidisciplinary clinic has been serving with kindness, confidence, and quality care to folks here in Denver. I'm here with Dr. Anderson. Thanks for joining us here today. You're a doctor of chiropractic, basically the director of the clinic here. Let's go back a few years, back when this began. Your passion began in New Mexico. It later evolved and finished up in Texas. You were pretty quick to come out here to Colorado and start sharing with folks your training. Share with me a little bit how you got involved in this.
Yeah, absolutely. So I've been in practice, Gary, for a little over 12 years. And over that time, our practice has really evolved. So what we do, Gary, is we specialize in peripheral neuropathy. The technologies that we use in our clinics is an advanced form of electrical treatment to be able to help patients in dealing with this condition. A lot of my continuing education has also been based around this condition of peripheral neuropathy.
Interesting. I mean, quite honestly, throughout our lives, we have some pains that may ail us. We might turn to conventional approach, hoping to get more than just a painkiller to take us away from our pain. How do you feel the conventional approach along with an alternative approach are really able to work hand in hand and provide the best care?
Absolutely. Most patients that we see dealing with this condition, they are on traditional medications for it because they have pain. So we see a lot of patients who are on things like gabapentin or Lyrica or tramadol, and all of that can be very beneficial because it can help manage the pain. Well, what tends to happen, though, is it's not addressing the actual nerve damage, which is the reason patients have pain. So really what our objective is to help these patients to improve function, to be able to get these nerves to fire better, and that's essentially what the treatment's doing.
Because of this integrative approach, are you really able to help folks with more of a customized plan for each one of their personal needs they walk through the door with?
Yeah, it's a great question. Every patient who's dealing with neuropathy, it can vary, the type of nerve damage. So we always want to understand the type of neuropathy they have. We want to understand what caused the neuropathy. And based on those things, Gary, treatment itself, it will change. So there's a lot of variation and things are customized based on the individual, the type of nerve damage, and the etiology or why they have it.
So let me ask you this. Obviously, folks out there, like you say, they've got pain already. Maybe they've even been through a back surgery, and maybe it failed for them. Share with me a little bit more of how you're able to help them in the technology.
Absolutely. What we do in our office is a treatment called electronic signaling treatment. It's a form of electrotherapy. What's unique about the treatment, Gary, are the frequencies and the amplitudes of current that we use. So when patients are dealing with nerve damage, what happens is these nerves don't fire like they should. So depending on the type of nerve damage, we'll program this machine to work at really high frequencies and high amplitudes of current. And the goal is to be able to get these damaged nerves to fire better. We want to improve neurotransmission. The other thing that this technology incorporates is what we term a vasomimetic device. It's a device that helps increase blood flow. So in addition to stimulating these nerves, we also want to increase circulation because blood helps things heal. So again, the whole objective with neuropathy is to improve function, and the treatment we do is designed to get these nerves to fire better.
So basically, you're getting the nerves to fire better. What are some of the symptoms out there that people walk through the door with that you've been able to help?
Yeah, so when this condition starts off, most of the patients will start to notice altered sensation in their extremities. It's usually in the ball of their foot or their toes, sometimes their fingertips, and it may be numbness. It may be tingling. And then eventually it can progress into burning pain or stabbing pain. A lot of patients we see, they may not have pain, but they have numbness and they have balance issues. So as this condition progresses, not only are there the sensation issues, but there's pain that they have. It can start to affect mobility and balance. We see a lot of patients who have fall risks. So it can be very progressive as it gets worse.
How does it begin with a consultation? What do you find in that initial appointment?
Well, when patients come in to see us, the main thing that we want to determine is if they're a candidate for treatment. And Gary, the way we do that is, number one, we have to determine the type of nerve damage they have. Most patients who walk in our door, they know they have neuropathy. But we have to understand if it's small fiber neuropathy, if it's a large fiber neuropathy, if it's what we term a polyneuropathy, because that's going to vary the treatment. The other thing we want to understand is the amount of nerve damage or how progressed it is. We have to make sure that it's not beyond the point of us being able to help. And this is all determined by a specific exam we do in the office. The third thing that we always have to understand is why patients have nerve damage, the etiology behind it. So a lot of times what we're doing is we're pulling old medical records and past lab works, or sometimes we're ordering blood work, because we have to understand if the nerve damage they're dealing with is because of a metabolic issue like diabetes, or is it from trauma from a surgery, or is it from a side effect of a medication? Because in addition to addressing the nerve damage with treatment, we want to make sure we address the reason they have it as well.
This damage that is done, is this taking place through, I mean, obviously you've got auto accidents or accidents like that, but I mean, throughout time, are we talking about just common wear and tear eventually can cause problems for us?
It can. So trauma can be a cause to peripheral nerve damage, but the most common cause to peripheral neuropathy is blood sugar problems, diabetes. We will also see patients who have nerve damage because of side effects of medications. Certain chemotherapies are known to cause neuropathy. Certain medications like statin drugs are known to cause neuropathy. We can see cases because of liver or kidney failure. We see a lot of cases that are more autoimmune or just chronic inflammation. So there's a number of things that we have to go through in determining why they have it.
Is this a new technology that people aren't really confident with? Are they a little bit apprehensive to come in and get something like this done? And is it painful?
The treatment itself is not painful. Now, patients will absolutely feel what's going on because there's stimulation. And to get back to your original question, electrical therapy has been used for many years, and there's different forms of it. We have like what's called transcutaneous electric stimulation, or TINS units. There's what we call interferential current, and those are very basic forms of electric current. What we use in our office is a more advanced form because of the frequencies and amplitudes of current, which are needed to get these nerves to fire better. But no, Gary, the treatment's absolutely comfortable, but patients will feel what's going on.
What about time-wise? How long does a treatment like that normally take?
Right. Well, a treatment itself, when patients come in, takes about 45 minutes of office time. And typically what I'm doing, and every patient's different, but typically we'll work with a patient for about 2 to 3 months. And over this time, we may do 15 treatments, we may do 25 treatments. But our goal in this time is to get patients to what we call maximum medical improvement, to get this condition as good as we can, 60, 80% improvement. And then from that point, we release patients from care.
As far as the safety of the treatment, so this is something you can pretty much take care of on any level as far as age group. I mean, are kids actually experiencing this type of problem as well?
Well, they can, but the majority of our patients are patients who are 65 or over. I mean, usually with neuropathy, it's because of, again, a metabolic issue or because of trauma, and usually those things come on later in life. So the majority of our patients are 65 or over, but we do have some younger patients.
We have someone out there who's possibly watching. They feel themselves being a great candidate for this. How do they find out, and what is the first step?
Absolutely. Well, the first thing that they would want to do is call into the office and schedule a consultation. Consultation is the first step. I mean, we use that to determine if we're able to help patients. And that's what I was referring to earlier. I go through a very thorough health history. After we get done going through the health history, I do an exam. That's where we can determine the type and severity of nerve damage. From that point, Gary, I'm usually assessing cases. I'm requesting old labs that have been done and trying to understand why patients have this condition and determining if we can help.
You take a very hands-on approach because you take care of everything here in the office. Does this help you to understand the patient better and also be able to track results?
Yeah, absolutely. We spend a lot of time tracking results, and I myself oversee every case. So we spend a lot of time with patients, and that's why we do what we do. It's if patients are going through treatment, they're seeing me, and results are important. So as we're going through this, we have to make sure patients are progressing.
Like you said, later on in life, we here in Colorado, we're pretty active, and we want to stay that way. Obviously, into our golden years, is this something that gives you great satisfaction in really being able to help folks get out there and enjoy?
Yeah, absolutely it is. A lot of patients dealing with this condition, there's a lot of frustration and a lot of patients who have lost hope because they've been told nothing can be done. A lot of times when patients come in, they're very skeptical because nothing's worked for them. And when we're able to get patients to a point where they can start to enjoy simple things, Gary, like sleeping at night, being able to go out and enjoy a hike with their grandkid, or being able to just simply go to a movie, or patients who get their stability back and they're not so concerned about just walking around, they feel more stable. They're not fall risks anymore. That gives us great satisfaction because it's really all about quality of life, and we live life once and we want to enjoy it.
Want to enjoy it? It's got to be very rewarding for you. Viewers, take a look at the bottom of the screen right there. What you're going to see, first of all, is their website. On the website, you can learn more about the services they provide here. They have specialized, originally a passion that began in New Mexico, and this is a doctor that came here to Colorado to share everything that he's learned. He basically takes a very hands-on approach, making sure that it's a personalized, custom plan that he's put together for you. It's very frustrating to be through pain, and you got to understand there's an office here that's available to help. That is the Front Range Medical Center, located here in Greenwood Village, Colorado. This is Gary Atencio with CNTV, and if you don't know, now you know.